Can you hold the pen like this? Some person having difficulty in holding the pen like this. Myself Sukumar, I am the student of occupational therapy. Dequervain syndrome. What the name Dequervain? It is a Swiss surgeon name. His full name is Fritz Dequervain, who first described the condition 1865. This condition, there is a affection of the tendon sheath. In our palmar region, we have some tendon sheath. In dorsal region, we have some tendon sheath. In dorsal region, first tendon sheath is affected in this condition. So it may be in the thumb and index finger side, this area. What is happening in the tendon sheath? It may be inflammation or degeneration or else the thickening. So fibrosis, thickening of the tendon sheath is also known as fibrosis in medical term. So these may be happen in the tendon sheath. This condition is most common for women than men because they are doing the cooking activities like this. When we doing radial deviation and thumb movements, this condition may be occur. So for women, this condition is more risk, and the age between the 30 to 50 is more common to having this disease, and this disease is common in dominant hand, so not in undominant hand. For me, right hand is my dominant hand. So your dominant hand may be work with a radial deviation and your thumb is rotating like this. So then you have the chance for getting the Dequervain syndrome. Let's recap the anatomy. In our dorsal compartment, we have 6 tendon sheaths. First tendon sheath protect abductor pollicis longus and the extensor pollicis brevis. These two are working for the thumb only. That is why it have the name pollicis. The first dorsal compartment is approximately 2 cm long, starting from the radiostyloid region to the radiocarpal joint region. So it is about 2 cm long. I already said in this first compartment, 2 muscles are present. One is abductor pollicis longus and extensor pollicis brevis. So what is the origin and insertion? We have to see. Extensor pollicis brevis origin from posterior part of the radius to the inserted into the proximal part. So proximal phalanx, base of the proximal phalanx. So here to here, like this, extensor pollicis brevis is present. And abductor pollicis. So working of the extensor pollicis is to extend the proximal phalanx. So what is the function of the abductor pollicis longus? It going to be abduct the thumb like this. So this is the adduction. So it going to be abduct the thumb like, or from two areas, the posterior part of the ulna and posterior part of the radius. So the muscle is coming like this and inserted in the first the metacarpal, base of the metacarpal. So first metacarpal. So this is second metacarpal, third, fourth, fifth. So this is the first metacarpal, base of the first metacarpal. So this is inserting like this. So originating from there, these two parts and inserting in this part. So it helps in abduction also, and it helps in extension also. Extension of the thumb is also assisted by the abductor pollicis longus. What is the cause for this syndrome? What is the cause for this syndrome? There is only one cause for this syndrome. It is overuse. So we don't overuse our thumb. So we have to give minimum amount of force in this thumb. So if we give force as well as the wrist movements like this, it may damage the tendon sheath of the first dorsal compartment. Nowadays we are all texting like this, so it is the most dangerous. It may cause Dequervain syndrome, and long use of computer mouse also can produce the Dequervain syndrome, and use of hammer, lifting heavyweight objects with the help of the thumb also leads to the Dequervain syndrome. What are the signs and symptoms? The patient may complain they have pain on the radial side of the wrist while doing thumb movement or wrist movement. They may have pain. Sometimes they may have the radiostyloid side inflammation. They have inflammation in this. We know this is the radial side. So this is the lateral side. So this is the radius bone. In this styloid process, there is a inflammation like we can see, and the tendon sheath may be thickened. So fibrosis of the tendon sheath is happened. For this Dequervain syndrome, we have to do one specific test, that is called in Finkelstein test. We have to ask the person to fist the thumb. So fist the hand with thumb inside. So fist the hand like this and ask the person to move the wrist towards the little finger side. So they have to do this movement. So if they can't do this movement, then Finkelstein test is positive. And we have to do differential diagnosis. In some other conditions, the persons may do the same like this movement and they may feel pain. So for what are the conditions? First, CMC arthritis. What is CMC? Christian Medical College? No, it is a corpometacarpal joint. So in this joint, they may have inflammation and it also leads to the Finkelstein test positive. To confirm the CMC arthritis, we have to do another more two tests called crank and grind test. We have to apply little pressure on the joint and we have to ask the person to move. So the person may feel pain, then it is called crank test. If the therapist apply the little force on the joint and ask the person to rotate like this, then it is called grind test. So they may have the pain or they may have the crepitus sound during the test. It seems it is positive. So if these are all present, then CMC arthritis is present. The person don't have Dequervain syndrome. The person with scaphoid fracture also seems like Dequervain syndrome. So how to differential diagnosis between them? So we have to touch the area. So if the person feel pain, so the tenderness is present in the scaphoid fracture, and we can also take an X-ray to visit the scaphoid bone structure. Chaffer's fracture. It is also the fracture of the radial bone. So the part of the radial bone is fractured and it get involved in the styloid area and it causes the pain. So it also the differential diagnosis. Intersection syndrome. It is the tendency problem in second dorsal compartment. In these two tendons are affected, extensor carpi radialis brevis, extensor carpi radialis longus. So it is also seems like Dequervain syndrome, but it is not. It is an intersection syndrome. And EPL tendinitis, extensor pollicis longus tendinitis. It is a third dorsal compartment problem. So in this also same pain and the same signs are positive in this condition also. Wartenberg syndrome. In this radial nerve is compressed. Superficial part of the superficial branch of the radial nerve is compressed. Tendons of brachioradialis and extensor carpi radialis brevis. For this syndrome also same pain like Dequervain syndrome is present. So we have to differentiate the diagnosis and also see 6 cervical radiopathy. In this there is a radiopathy, the compression of the radial nerve in the cervical region, and it may cause the pain and difficulties in the breast region. So this is may have the same diagnosis criteria. So we have to differentiate the conditions. On examination, we have to examine fist grip strength and a pinch strength like this. This is a pinch and this is a fist grip strength. So how can you make the fist with using the thumb inside and as well as outside? And we have to observe resting posture of the thumb and resting posture of the wrist and inflammation or any other abnormalities in the breast and the styloid area. We have to notice on observation. On palpation, on touching, we can notice the pain. So the person may feel pain, that is called the tenderness. On palpation, they may have pain, that is called tenderness, and we have to feel the tendencies. There is a fibrosis in the tendencies, we have to notice, and we have to analyze the range of motion, the joint movement. So first wrist range of motion and forearm range of motion and shoulder range of motion and cervical range of motion. So there may be a chance for nerve compression. So we have to take all range of motions. So if there is a nerve compression, they may limit the range of motions in all compartments. And we have to notice the Tinel sign. So from here we have to tapping like this. So the person may feel tingling sensation or pricking sensation, the needle pricking sensation. These are all may felt by the person. So if this is felt, the nerve is something happening in the nerve. We have to notice there is a involvement of nerve is present or not. If there is present, we have to check for the dermatome, myotome, and reflexes also. So we have to note which is skin or getting enough sensation. So this skin is sensed by the person. So we have to notice everything. What are all the management for Dequervain syndrome? First goal is to restore the thumb activity and wrist activity of the person. And we have to focus on the inflammation process. If the inflammation is caused by any other immune response, so we have to stop the inflammation process and we have to confirm the pain and other symptoms are never ever come back to the same person. So in medical management, we have to reduce the inflammation, so we can give non-steroidal anti-inflammatory drugs. In rehabilitation, we have to do wrist strength and wrist strengthening activities, grip strengthening activities, wrist flexion extension activities. In orthosis, finger sprints also used sometimes. Immobilization, cold compression and strengthening activities for the thumb also given to the person to recover his normal state. We also have surgery management. If the nerve is compressed, then we have to do the decompressive surgery. So the compressed area should be removed and the nerve should be become normal. So then only they can improve their movements. So for this decompression surgery person, so for this person it takes 3 to 6 weeks to recover his hand strength and make a movement like this. I want to say one thing. Thank you for watching this video. I really proud of you because you are studying. So I want also motivation. You have to subscribe my channel. So if you want more videos, you can say in comment. So which condition you need. So what topic you need. I can refer the books and I can teach for you. So thanks for watching. Ta-ta.